Question I keep getting about illnesses, especially diabetes, and me pushing plant-based diet. So Dan, why are all these charities not pushing a plant-based diet? We keep hearing this thing on all the news, and even from these charities, that diabetes alone costs the NHS £10 billion a year. That's 10% of everything it has. So why would it be doing this if there's an easy solution? So what you have to ask yourself is, where does this 10 billion go? We're not throwing it at diabetes and hoping it runs away. It's going to someone. So who's it going to? And why are these charities not pushing what we know is the solution? I mean, look, just have a quick look at this study. This is the risk difference between vegans, vegetarians, pescatarians, and non-vegetarians. As you can see from having a plant-based diet, you are halving, more, even better than halving your chances of diabetes. And bear in mind, this is just saying vegan. A lot of these people are eating Oreos and vegan sausage rolls and all this kind of stuff, not to the whole food diet that we're talking about. So yeah, why are these charities pushing it? Well, let's have a look where they get their money from. Remember, this £10 billion is going somewhere. It's going to pharmaceutical companies. It's going to pharmacists. It's going to medical companies, not health companies. So let's have a look. Seeing as diabetes is the one that's come up most, let's have a look at the main website for the UK. So here we go. So here we are on Diabetes UK's website. So let's have a look where they get their money from. Why do they push what they push? Who is paying them? So let's have a look. Partners. So these are the current partners, the people that are giving them the money. Let's have a look. Abbott is a medical supplies company. Boehringer is a pharmaceutical company. AstraZeneca, pharmaceutical company. We have Boots, which is a pharmacist, amongst other things. Fitbit, we're all good with Fitbit. Lilly, that is a pharmaceutical company. Novo Nordisk is a pharmaceutical company. Pharmacies for You is a pharmacist. Roche is a pharmaceutical company. There at the bottom, we have Sanofi, which is a pharmaceutical company, and Tesco, which sells lots of the stuff that this website recommends in recipes. So let's have a little look. Let's have a look on the same website. Let's have a type in of recipes. Let's see if these stick to the plant-based recipes that are shown to avoid and even reverse diabetes. So straight away, we're looking at some meaty kind of stuff. Let's just search meat. 291 meat recipes, so that's the majority of them, which are meat recipes. Let's have a look how we can break that down. Beef, so a big one for cancer as well, 22. Pork, one of the worst ones we can have, even more at 24. Let's have a look at chicken. 96. Yeah, we see that it causes the same problems. Fish, so even away from typing in meat, 176. Look at this stuff. So this is all the stuff that we're showing through some really good research is the cause. So we've got 30, which have got butter. Let's have a look. Let's look at dairy products overall. So hang on, let me just make my fingers work. Okay, dairy. There we go. Now we have dairy. So dairy overall, 212. They are trying to make people sick. They are cashing in. So there you have it. 10 out of 12 of the companies which are paying Diabetes UK are cashing in on diabetes. Absolutely cashing in. So why would they change their sites? There's no greengrocers. There's no small-time people selling vegetables who are able to pay these companies. These companies, including Diabetes UK, including all these charities and help places, they're cashing in. That's where your 10 billion's going. It doesn't cost £10 billion. That's the profit that is coming from diabetes. You take that profit away, all these companies are gone. CEOs of these charities that are all absolutely flush and loaded, gone. Why would they? Why would they? You do what's best for you and you look at the research for yourself. Go and have a look. And the amount of you that I'm throwing research towards and you're ignoring it. Not even ignoring it. You won't even open it. I'm scared to open it. You should be. You should be, because you're killing yourselves. And the information's been there. By all means,
Do what you want with the information. If you want to take control of your health, if you want to control what is happening with your body and your life, then start looking properly. Stop being lazy and listening to unhealthy, overweight doctors and nurses and people that are literally paid for you to be ill. Healthy people don't make doctors anything.